This week on Healthy Living, a surge in cholera outbreak globally is raising concern among experts. UNHCR urges for international support for cholera outbreak among refugees. And do you struggle with razor bumps or ingrown hair? We'll have some tips from the experts. Plus, an analysis by the WHO reveals that COVID-19 vaccination coverage has stagnated in half of African countries. We'll have these stories and more in this edition of Healthy Living. Hello, I'm Linor Moudou. Welcome to Healthy Living. It causes dehydration, diarrhea, and can lead to death. It is cholera, and it's sweeping through countries worldwide. After years of a decline in numbers, the world has seen an upsurge in the waterborne disease over the past year, according to the World Health Organization. Cholera is a highly contagious disease that affects both children and adults. Symptoms can appear anywhere between 12 hours and 5 days after the consumption of contaminated food or water. Experts say cholera can be prevented by ensuring access to clean water and basic sanitation and hygiene. However, over 1.7 billion people still do not have access to basic sanitation services, such as private toilets or latrines. Health authorities are racing to contain the outbreak of cholera that is spreading in countries worldwide. The unprecedented rise in cases has forced a shift in vaccine strategy.
Kenya has become one of the latest countries to report an outbreak of cholera. Health officials in the country have recorded at least 61 cases of the disease in 6 regions, including in the capital, Nairobi. The World Health Organization says since January this year, at least 29 countries have reported outbreaks, including 13 countries that did not have outbreaks last year, and in the previous 5 years, fewer than 20 countries on average. Experts say cholera cases have surged worldwide this year, especially in places of poverty and conflict.
With climate change and the warming of certain water places and deltas in the world, we see that the bacteria can multiply much faster. And this is why also we have much bigger outbreaks in certain places in the world. And I think this is why it's so important first to look at cholera as a global issue, because with climate change, we know that other places can become a sort of endemic places for cholera. And secondly, because it's very important to understand that if we can prevent outbreak in places where the cholera is in the environment, we will have a much better control on the risk.
Cholera is an acute diarrheal infection that can cause fatal dehydration. It's spread by the ingestion of food or water infected with Vibrio cholera bacteria. Health officials in Cameroon say several hundred cholera cases have been detected on the country's northern border with Nigeria, with at least 17 people dead. An outbreak in Malawi that has spread in 22 districts has killed over 100 people. Aid agencies are sounding the alarm on a growing outbreak in Haiti, with more than 600 suspected or confirmed cases in the area surrounding the capital, Port-au-Prince. The disease has infected and killed people in countries like Syria and Lebanon. With the outbreaks of cholera worldwide, the WHO has reported a shortage of cholera vaccine doses, forcing a temporary shift to a one-dose strategy.
Since 2013, WHO, UNICEF, Medicines Sans Frontières, and the International Federation of the Red Cross and Red Crescent Societies have jointly managed a global stockpile of cholera vaccines to help control epidemics. However, the current wave of outbreaks is putting unprecedented pressure on the stockpile. As a result, the 4 agencies have decided to suspend the 2-dose strategy in favor of a 1-dose strategy so that more people receive some protection from limited stocks. The 1-dose strategy has proven effective in previous outbreaks, although evidence on how long protection lasts is limited.
The WHO says a few million doses of vaccines are available for use before the end of this year, partly due to a shortage of manufacturers.
Dr. Shamsuddin Abdullahi, resident doctor with the National Hospital in Abuja, Nigeria, tells us more about cholera.
It can manifest within 12 hours of contact. So from 12 hours to 5 days, averagely 1 to 2 days. Another thing that is making it so contagious is it has some genetic materials that will allow it to attach into the intestine cells, and therefore it can replicate in millions. It can replicate and one can be excreting it out. When you excrete it out, it will, some other people can pick it maybe by contact with you or contact with your excreta. Usually it's settled down in water and food. And now we are having so much flooding, so it's happening now currently in Pakistan and other countries that are having a lot of floodings. And also some particular areas that has some crises like IDP, so that's where you can see it. And also in some, slums areas. This epidemic week, I think it started from the early September to this 1st October. So we are waiting for the next release of the data. And it has shown that about 42% increase from the previous month. So which means we are having some, new cases that are occurring maybe because of the flooding and other things. When it occurs, early identification, maybe from how it manifests, then to the laboratory diagnosis to confirm whether it is a cholera or not is key. Then aggressive treatment with fluids, IV fluids, specifically there is one solution that is specifically designed for patients with cholera. They call it DACA solution. But in absence of that, most common one that is always available, maybe the Ringer's lactate. Then you can give also the ORS, oral rehydration solution. It's very important. If you have this IV fluid, aggressive IV fluid with antibiotic and ORS, so it can be controlled. Then for prevention, if there is a safe supply of water for the community, also one has to, personal hygiene. Then another thing that is very important is the vaccine. I think there is about 3 vaccines that are available for the cholera. So it's one supposed to take at least 2 doses for it to be effective. However, there is one of the vaccines that currently, I think in this October 2022, the organization or the community that are responsible for distribution of these vaccines, they have agreed that one of the vaccine can be given one, and it's shown to be very effective because of the outbreak of cholera that is happening all over the world. So that's why they are having maybe shortages. That's why they consider reducing the doses so that other doses can be diverted for the purpose of intervention where there is outbreak. In terms of disaster like this, if you cannot have safe drinking water, at least even if you are getting your water directly from the river, so you can boil it or you can add some chlorine in it to kill the cholera in the water.
UNHCR has urged for international support to combat the cholera outbreak among refugees in Cameroon. The UN Refugee Agency says up to $250,000 is needed to increase access to clean water, improve waste management in the camp, and address other urgent needs. I spoke to Olivier Beer, UNHCR representative in Cameroon.
What we are doing also is to sensitize refugees about waste management and the importance of using latrines when we have them. Because another gap that we have a gap of 900 latrines. Minawawo refugee camp was designed at the beginning for 20,000 refugees maximum. But we had 30,000 and now we are at 75,000. But with the same budget that we had 5 years ago with 30,000 refugees. Refugees are here for quite some time, not only the Nigerian, but also the Central African. And it's very difficult to get humanitarian funding for protracted refugee situation. But it does not mean that refugees are already able to fully take care of themselves. Why? Because these regions where usually are refugees are remote areas where development is also missing. We are confronted with development challenges that we cannot address. To respond to cholera effectively, what I have seen, my experience is that you need a series of things to happen, a series of response to happen, because it links to the numbers of latrine, the numbers of medication, the numbers of the availability of potable water, waste management, sensitization, entrance, catheters, all these things. So what we need to do is to make sure that everything will be addressed, will be responded to, and then you can afford to have one dose of vaccine because you have potable water, because refugees know that they have to use the latrines, because you have sufficient health personnel that we don't have for the moment. I'm more optimistic because I've seen that for this particular outbreak, we managed to work all together. So if we are developing leadership, coordination, and we have enough resources, I'm very optimistic that this can be not only solved and responded to, but prevented, because floods are happening every year. We know the problems, we know the context in which we are living. We can, today in 2022, in a country like Cameroon, we can avoid cholera. On the donors, on everyone assisting us, of course, I thank already for the support that we are getting, but I want to say it's not enough. We need more. We count on the states, we count on the donors to help us more, because we don't want this to happen next year.
Do you struggle with razor bumps or ingrown hair? If the answer is yes, you are not alone. Many people experience ingrowns or razor bumps after shaving. This occurs when cut hairs start to grow back down into the skin rather than growing out above the skin. Experts say ingrown hairs often look like skin-colored or red bumps. They can be painful. Pus-filled bumps often get worse the more you pick at them and leave some marks on the skin. To prevent ingrowns or razor bumps, experts recommend exfoliating with a gentle scrub or a cleanser containing glycolic or other alpha-hydroxy acids before shaving, as doing so can reduce the layers of skin covering where the hair is growing. Applying a warm, wet washcloth to the skin can help soften the skin and draw the ingrown hair out. Try another hair removal techniques such as hair removal creams and laser hair removal if accessible to you and safe. If all fails, consult with a doctor or pharmacist who can recommend adequate over-the-counter or prescription treatment. COVID-19 vaccination coverage has stagnated in half of African countries, while the number of doses administered monthly declined by over 50% between July and September, according to an analysis by the WHO. The findings reveal that although Africa is far from reaching the year-end global target of protecting 70% of the population, modest progress has been made in vaccinating high-risk population groups, particularly the elderly. Overall, as of 16 October 2022, just 24% of the continent's population has completed the primary vaccination series, compared with the coverage of 64% at the global level. Liberia has now joined Mauritius and Seychelles as one of 3 countries to surpass 70% of people with full vaccination coverage. Rwanda is on the verge of achieving this milestone as well. Meanwhile, experts are turning their attention to a pair of new variants that are steadily spreading, BQ1 and BQ11. Both are from BA5, an Omicron subvariant that currently accounts for about 68% of COVID-19 cases in the U.S., according to data from the U.S. Centers for Disease Control and Prevention. In a study posted online in October, researchers found that BQ11 is able to evade antibodies from past BA5 infections. That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on Twitter at Linor Moudou. Until next time, stay well and strive to make every day a healthy day.